I have decades of expertise as a cardiac surgeon, and I have seen thousands of elderly people come into my office with concerns about sudden lethargy, dyspnea, or chest pain. Furthermore, stress and food are frequently not the only causes. They had been taking the drug for years. In some cases, it was even prescribed to treat another illness. Many elderly individuals are unaware that certain common medications, which are taken by millions of people over 60 every day, might cause silent harm to the heart muscle, raise blood pressure, or cause irregular heartbeats. These medications may not always have adverse effects immediately, but they have the potential to weaken your heart over time and maybe shorten your life. I'll list the top 7 medications that could be endangering your heart health without you even recognizing it in today's video. This has to do with awareness, not terror. You should watch this through to the finish if you or someone you care about is over 60 and taking medicine for mood, blood sugar, sleep, or pain. In addition to being the most dangerous, pill number 1 is also the most widely utilized. You deserve to know the facts so that you can make wise decisions. But I'm not asking you to quit doing anything without first getting medical advice. Let's get started. Non-steroidal anti-inflammatory medicines, or NSAIDs, are the first medication on our list, number 7. These include well-known brands like naproxen and ibuprofen. They are frequently used to alleviate back pain, joint discomfort, and arthritis, which afflict most seniors. Many persons over 60 take these medications on a daily basis without understanding the potential heart risks. NSAIDs have the potential to increase blood pressure and cause fluid retention in the body. That may not seem like much, but for an elderly or weakening heart, the pressure created by the extra fluid could be sufficient to cause irregular heartbeats or heart failure. Over time, NSAIDs can also damage the lining of your blood vessels and reduce kidney function. And when the kidneys don't work efficiently, the heart has to work even harder to compensate. If you're already taking medications for high blood pressure or heart disease, NSAIDs can quietly interfere with their effectiveness, further putting your heart at risk. The danger is that you might not feel anything unusual at first, but your heart could be under constant silent strain. That's why I always tell my senior patients to be very cautious with over-the-counter painkillers. Pain relief is important, but it should never come at the cost of your heart. Safer options are available, and it's always best to talk to your doctor before continuing any NSAID for more than a few days. The 6th and subsequent pill belongs to a class of diabetes drugs called thiazolidinediones, which includes pioglitazone. This moniker could sound familiar to those who are managing type 2 diabetes. These drugs work by making your body more sensitive to insulin, which lowers blood sugar. Even with the best of intentions, they can subtly hurt your heart, especially if you're elderly. Fluid retention is one of the most common adverse effects. Your legs, ankles, or feet may swell as a result. Fluid accumulation raises the risk of congestive heart failure, a condition in which the heart finds it difficult to pump blood efficiently in people with an aging or pre-existing heart ailment. Seniors with diabetes are already at a higher risk of heart disease, and adding a drug that increases fluid retention can make things worse. Even more concerning, this medication can mask early warning signs of heart trouble, such as fatigue or shortness of breath. It can make you feel like your blood sugar is under control while your heart is quietly being overworked. Some doctors continue prescribing these medications because they are effective in lowering blood sugar. But effectiveness should never come at the expense of heart safety. If you notice swelling, difficulty breathing, or persistent fatigue while taking one of these drugs, you should consult your doctor. There may be safer alternatives available that support your blood sugar levels without putting your heart in danger. Moving on to number 5, we have sleeping pills, particularly sedative hypnotics like zolpidem and older medications like diazepam. Sleep becomes more difficult as we age, and many seniors rely on these medications to get through the night. But while they promise rest, they can come with serious risks, especially for your heart. Sedatives work by calming the central nervous system. This includes slowing your heart rate and lowering blood pressure. At first glance, that might sound like a good thing. But during sleep, your body needs to be able to respond to dips in oxygen or sudden stress. These medications blunt that response, leaving your heart more vulnerable. Sleep apnea is one unspoken risk. This condition, which causes you to cease breathing for brief periods of time while you sleep, can be brought on by or made worse by sedatives. Your heart feels strained every time you pause your breathing. Frequent nighttime episodes of low oxygen levels can lead to arrhythmias, hypertension, and ultimately heart failure. Sleeping medicines can reduce the effectiveness of other cardiac treatments in addition to increasing the risk of heart problems. Seniors who use these medications are also more likely to experience memory problems, confusion, and falls. Long-term dependence is unsafe, even though occasional usage under supervision might be acceptable. Speak with your doctor about safer or natural remedies for your sleep issues that won't harm your heart or brain. Now let's talk about number 4, a group of medications called tricyclic antidepressants. These include drugs like amitriptyline and nortriptyline, which were once widely used for depression, anxiety, and even chronic pain. While they've helped many people over the years, they come with serious heart-related side effects, especially in older adults. Tricyclic antidepressants can interfere with the heart's electrical signals. This can lead to irregular heartbeats, changes in blood pressure, and in severe cases, a condition called heart block, where the electrical pathways in the heart are partially or completely disrupted. Because the heart loses its ability to adapt with age, seniors are more vulnerable to these disturbances. These medications have the potential to accumulate in the body over time, even at low dosages. You may experience weariness, lightheadedness, or a sensation of your heart beating irregularly or fluttering. It is important to pay attention to these signs. Newer antidepressants don't have the same cardiovascular dangers and are significantly safer for older adults. Nonetheless, some physicians still prescribe tricyclics merely because they have done so in the past or out of habit. It's crucial to have your heart checked frequently if you're taking one, and to find out whether there's a safer substitute that still promotes mental and emotional health. Before we go to the top 3, I want to share something important. If you're over 60 and taking any medications, or if you simply want to take better care of your heart, consider downloading the Senior Health Tracker app. This tool was built specifically for older adults. It lets you track your medications, log symptoms, and spot early warning signs before they turn into serious problems. Most health apps aren't designed with seniors in mind, but this one is. Because of high demand, we're only offering limited access this week, so don't wait. You'll find the download link in the pinned comment and the description box below. Stay informed, stay proactive, and stay in control of your health. Now let's continue with pill number 3, decongestants like pseudoephedrine and phenylephrine. These are found in many over-the-counter cold and allergy medications. Seniors often use them to relieve stuffy noses or sinus pressure, especially during allergy season. But these pills work by narrowing the blood vessels in your nose, and unfortunately, they don't stop there. They narrow blood vessels throughout your entire body, including those that supply your heart. This increases blood pressure and forces your heart to work harder. For someone with an older cardiovascular system, that extra strain can be dangerous. Even short-term use can raise your heart rate, trigger palpitations, and cause you to feel jittery or anxious. These are all signs that your heart is under stress. If you already have high blood pressure or a history of heart disease, taking decongestants can lead to serious complications. What makes this even more concerning is that these medications are sold over the counter, making them seem harmless. But age changes how our bodies process medications. Something that felt fine in your 40s may now be a serious risk. Always read the labels carefully and consult your doctor before using any decongestant, even for a simple cold. Now we move to pill number 2, proton pump inhibitors, or PPIs. These include drugs like omeprazole and pantoprazole, which are commonly used to treat acid reflux and heartburn. Millions of seniors rely on these medications daily, believing they're completely safe. But long-term use of PPIs has been linked to increased risk of heart problems. These medications reduce stomach acid, which does help with reflux. But stomach acid is also necessary for absorbing vital nutrients like magnesium. When magnesium levels drop too low, it can lead to irregular heartbeats, fatigue, and even muscle cramps. This condition often develops gradually and may go unnoticed until serious symptoms appear. In addition, long-term use of PPIs can disrupt the balance of gut bacteria. This increases inflammation in the body, which is a known contributor to cardiovascular disease. If you've been taking PPIs for more than a few weeks, especially if you're over 60, you should reassess your treatment plan with your doctor. These medications are meant for short-term relief unless there's a specific medical reason to use them long-term. If you're dealing with chronic heartburn, the better approach is to identify and address the root cause instead of masking it with long-term medication. Your heart health must come first. Finally, we arrive at pill number 1, the most dangerous and commonly prescribed medication for seniors with heart conditions: calcium channel blockers. These include drugs like verapamil and diltiazem. They're often prescribed to manage high blood pressure, chest pain, or certain heart rhythm disorders. While these medications can be highly effective, they may also slow the heart down too much. For seniors, this can lead to dangerously low heart rates, dizziness, fainting, and even shortness of breath. Over time, they may also cause fluid buildup, swelling in the legs, or worsening fatigue. Some types of calcium channel blockers interfere with other medications seniors often take, increasing the risk of drug interactions and complications. The biggest issue is that these drugs are often prescribed without enough monitoring. Side effects may be mistaken for signs of aging rather than signals of a drug problem. If you feel excessively tired, weak, or notice swelling in your lower limbs, your medication could be contributing. Never stop taking a heart medication without speaking to your doctor, but always ask if there's a newer, safer option better suited for your age and condition. Medication should support your heart, not silently work against it. To wrap up, if you're over 60 and taking any of the pills we've discussed today, I'm not telling you to stop them on your own, but I am urging you to speak with your doctor. These medications were created to help, but when taken long-term or without proper oversight, they can slowly harm your heart. As a heart surgeon, I've seen far too many seniors end up in the hospital, not because of their illness, but because of the side effects of medications they trusted. The goal here is not fear, but prevention. With the right awareness and support, you can live longer, feel stronger, and stay independent. Remember that you may use tools like the Senior Health Tracker app to keep track of your symptoms, remember to take your meds, and receive alerts when something changes. The time to take charge of your health is now. Keep yourself informed, remain vigilant. Additionally, don't be afraid to inquire about the medications you're taking. You cannot ignore the importance of your heart. For more life-saving tips tailored just for elders like you, please subscribe and share this video with your loved ones if you found it useful. Be careful and maintain your fortitude.